If you guys want to get that shoulder that not only creates that V taper everyone is after, but also looks like two small mountains from the side, well, you'll want to stick around for this video because today we'll be talking about the best exercises that you should be doing if you want to effectively target and grow your delts while minimizing the risk of re-injury. Hi, my name is Leo Seidel. I hold a doctorate in physical therapy, and I've worked with countless patients with all sorts of different orthopedic conditions, ranging from professional athletes in the NFL, NBA, and D1 spaces, all the way down to those just wanting to get rid of that nagging knee pain when they walk. My whole purpose with this channel is to get some of my experience as a current lifter, a former college athlete, and as a professional physical therapy to give you guys some of the tips, tricks, and knowledge that the pros use in order to rehab from their injuries and optimize their strength and performance. If you guys like this type of content and you want a one-stop shop for helpful advice on injury recovery and performance optimization, make sure to like this video, subscribe to this channel, and ring that notification bell so you get notified every time a video comes out. So let's jump right in. The shoulder is comprised of three main parts: the anterior, the middle, and the posterior delts. While all these heads are technically part of the same muscle fibers are typically orientated in the direction that they prefer to pull in. And so it stands to reason that a large muscle, such as the delts, can be preferentially targeted by positioning the shoulder in different positions. The primary motions that the delt performs at the shoulder is flexion, abduction, extension, and internal and external rotations. And while it is true that technically your entire shoulder is active in exercises such as a shoulder press or a lateral raise, our goal here is not just to activate the muscles, but to preferentially and optimally target each muscle. A good understanding of how to combine the motions of the shoulder is key in achieving this goal. So let's start off with the anterior delt. Because the fibers are orientated more in the sagittal plane or front to back plane, they will most optimally be activated with flexion-based exercises or movements, such as a front delt raise or a shoulder press. Within these two, the shoulder press reigns supreme, as the potential for loading is significantly greater than with a front raise. However, because of this loading, it's important to keep the elbows approximately at 45 degrees in front of you in order to allow these fibers to work as designed and avoid excess stress to the non-contractile tissues of your shoulder, such as your ligaments and labrum. Front raises can be performed after shoulder presses as a secondary exercise for the front delts. Moving on to the side delt. There are a bunch of ways to train this muscle, such as a dumbbell, cable, or machine lateral raises, as well as many variations of different upright rows. From all of these, cable variations of lateral raises and rows have been shown to elicit the most muscle activity, as cables are able to maintain the tension throughout the whole movement, as opposed to dumbbells and free weights that lose tension at the bottom of the range. With any exercise that you choose, it is essential that you remember what the main function of the middle delt is, and that is shoulder abduction, or raising your shoulder out to the side. Motions in which the weight is raised in the frontal plane or out to the side will always be superior to those in which the weight is anterior or posterior to this plane, such as in a generic upright row. My recommendation for the greatest activation is to start off performing 3 to 4 sets of a cable raise, my personal favorite being the Egyptian lateral raise as shown on screen. Then follow this up with a dumbbell or cable rest pause technique, which goes as follows. Pick up a weight that you can do for approximately 20 repetitions. The exercise is broken down into 2 parts. Firstly, perform the 20 reps, followed by a 30-second break. Secondly, while keeping the same weight, perform 4 sets of 5 to 10 reps, while resting 5 to 10 seconds between each of these sets. This will for sure set your shoulders on fire and is a great way to stimulate growth in this stubborn area. Lastly, but not least, we have the posterior delt. If we look at how these fibers are orientated, they're ideally positioned to perform either external rotation, extension, or horizontal abduction of the arm when it's out to the side. The problem with just doing any of these motions is that your back has a lot of musculature that already does a few of these things. For external rotation, you have your rotator cuff muscles as primary movers. For extension, you have your lats as a major muscle that does this action as well. However, there are no muscles outside of the posterior delt that does shoulder horizontal abduction as a prime movement. This makes movements such as the reverse pec deck and bent over dumbbell flies the best movements to target the posterior delt and stimulate sufficient muscle growth. Make sure that you are not externally rotating your arm while performing these, as this excessively targets and activates the rotator cuff muscles and takes away from the posterior delt. Here's a suggested workout program that takes into account all the things we talked about today, and it condenses it into possibly the best all-around shoulder program for optimal activation and growth while avoiding injuries. Feel free to pause this video and screenshot it for your own personal use or reference later as you need it. One of the most frustrating things is getting hurt right before a big PR or when you start to see those changes you've been after for so long. And so my goal as a lifter and professional in sports rehab and performance is for this channel to provide gym goers with the most effective training strategies while minimizing the risk of common injuries and setbacks. I also have a goal to cover every common injury that could happen in the gym or in your daily lives and give you guys the ways to effectively rehab yourselves from those injuries so that you get back to doing what keeps us all sane and happy. If you guys want me to cover any specific topics ranging from lifting tips, best workout splits, exercises, or any injury rehab advice, feel free to put those down in the comments and I'll do my best to address those in my channel. So if this is something that you guys like and are interested in, make sure to like this video, subscribe to this channel to follow along in this journey. Thank you guys so much for watching this video. As always, I'll see you guys in the next one.